I believe that mastering of key concept is the key for a successful NCLEX. There are certain concepts you have to master. Whatever question they're going to give you, whatever test they're going to give you, there will be a few concepts that will keep on popping up. And these are concepts we're going to talk about. I'll show you how to answer them, test-taking skills. Let's get to it. Prioritization, you have to master it, right? But how do you master it? You have to know your content. And after you know your content, you got to bring some strategy that will keep you focused. And that is the way I do prioritization. I've mastered the content, and then I come up with a B sharp. Okay, taking care of some breathing, electrolyte shock, sepsis, hypothermia, pain that will make you lose your life. All this means is things that you do not expect. And when you let it go, it's going to kill the patient versus an expected finding. That's all. If I see an unexpected finding, it cannot be a B-sharp moment. So what do we have? Which client situation need priority intervention? The nurse is returning phone call at the cardiology clinic. Which one need intervention? All of them have CHF, so don't worry about it. Divide it. And what is the problem? First patient, dizziness, why on what? Bumetanide. This is what? Loop diuretic. What is one of the side effects of loop diuretic? It's dizziness because of orthostatic hypotension. The most serious one is hypokalemia, or it's a sulfur drug. You worry about Stevens-Johnson syndrome, and therefore this is not something you should worry about. It's an expected finding, right? CHF, I have rash after sun exposure, while on what? Chlorothalidone. Bring your content. CHF, rash. When did that happen? When I go outside to sun for sun exposure? Look at it. What is this medication? Chlorothalidone. This hydrochlorothiazide derivative. It's also a sulfur drug. One of the side effects of sulfur drug is photosensitivity. This is not Stevens-Johnson syndrome. Therefore, we take it out. CHF, taking salt substitute while on what? Dry amitriptyline. Do you recognize this medication? It's potassium sparing. Salt substitute means I have no sodium in my salt. All I have is what? Potassium. When you're on potassium sparing, you should not be taking any more potassium. This patient is in trouble. Hyperkalemia, bad problem. CHF, heart rate of 61, while you're on what? Metoprolol. Metoprolol, that's what it's going to do. Drop your heart rate to 61. Don't worry, 61 is okay because they are metoprolol. If it's 40, 50, yeah, you worry about it. But this is not definition of bradycardia. Therefore, if you have to be sharp, you have eliminated the expected finding and you have to choose C. Prioritization 101. Number 2, same strategy, right? Which of the following assessment findings need further intervention? A client with a history of what? Bipolar, buzzwords. On what? Lithium. Present to the outpatient mental health clinic for evaluation. Whenever I'm answering a question, as you can see, I'm just circling the buzzwords, the keywords, and I focus on them to answer the question. These 3 sentences are only dealing with 3 words: further intervention, bipolar, and lithium. When you're on lithium for bipolar, you should avoid dehydration. You should avoid dehydration. You should avoid dehydration times 3. So everything that is related to dehydration. So your sodium is low, it's related to dehydration. So for this one, I'm looking for something that is not expected, and it's a B-sharp moment, right? Pressured speech, bipolar patient, that's what they are, right? They never sleep, they keep on going. Dry mouth is a side effect of lithium, but it's not that dangerous. It's the minimum side effect. When you're lithium, you should have some dry mouth. But when you have nausea, I need to further intervene. The early signs of lithium toxicity is GI symptoms. This patient is getting sick. Signs of bad lithium toxicity. Dry mouth is expected finding of lithium, but when you have nausea, it's a side effect. Okay, side effect that will put you into higher level of toxicity of lithium. This patient is telling you your GI tract is very good. It's designed to tell you it's the only portion of the body that will tell you something is wrong from the beginning. So nausea, when you're taking a medication, you have nausea, it's an early sign that something bad is coming. The same thing applies to digoxin. This is lithium. So C, you need further evaluation. Why are you nauseated? Number 3, same strategy. Which client situation need priority intervention? Be sharp, but not unexpected finding, right? A nurse is caring for 4 clients on the ward. Look at the situation, divide it. If that's what you expect for this patient, let it go. Trigeminal neuralgia. I know you're supposed to have pain in your cheek, in your face, when you touch it. Severe shock-like left facial pain when chewing. Okay, that is what I expect you. I cannot help you right now. I'll give you pain medication, but I have 1 second. I need to find somebody who is there, who I need to take care of right away. Migraine and severe throbbing left-sided headache with photophobia. Classic definitions of migraine. Don't worry about it. Don't worry about the severe. What kind of severe? It's headache. It's not subarachnoid hemorrhage. Diverticulosis, anheides. You have pain. I expect you to have pain when you have anheides. And the pain is on the left lower quadrant. When you have anheides, I expect you to have fever. Therefore, this is what I expected. Glaucoma with the severe reddening, unilateral pain with halos and nausea. Glaucoma don't have pain. Okay? They don't have pain. But when they come in with an acute onset, one side, unilateral, seeing halos, some nausea, loss of their peripheral vision, you know they have what? Closed, angled glaucoma. That's the problem. Okay, closed angle glaucoma. That is a problem. Okay, usually if you have bilateral open angle glaucoma, it's not painful. Okay, it's a gradual process. This is an acute problem. Severe reddening, unilateral high pain with halos and nausea. I know that this patient is the priority. All of them has pain, but whose pain is going to lose their life, their limb, and their eyesight? This is all I care about. If you're not going to lose your limb, I'll let you go. Your life, I'll let you go. But when you're going to lose your eye, I got to take care of you. The only person who's going to satisfy this requirement is a glaucoma, which is the one we need to see. Number 4, what we are. The client was admitted to the hospital from the emergency department due to what? Serum sodium of 125. Which of the following intervention the nurse should prioritize? Think about it. 125 is way low. Sodium level is 135 to 145. 125, hyponatremia, worry about seizure. You see, I'm just focusing on the normal and bring my content. If I'm worried about seizure, every answer choice, look at it in the eye of a seizure. Administer 0.45% of normal saline. When you are hyponatremia, you should not give them anything less than 1% or 0.9%. If you give them 0.45%, this will drop this 125 lower. You should give them something greater than 1% or 0.9%. So they usually get 3% or 5% for hyponatremia. This will make things wet. So this what? You should not prioritize this. Ensure all bed rails are all padded, right? All the bed rails are padded as much as possible because they're going to have seizure. Bed at the lowest position is good. Clear liquid diet for comfort. Don't let them drink anything. This patient is going to have seizure. Place a bite block in their mouth. They're going to seize. If you put a bite block, you're going to aspirate or choke on it. So the only thing that you need to do is B and C, prioritization and critical thinking. Next question. Which of the following statement need priority intervention? A 55-year-old client with CHF, okay, was prescribed with Digoxin. After 3 months of therapy, patient presented to the clinic for evaluation. The same thing, I'll keep on asking you concepts to pay attention to. I give you Digoxin for CHF, you come in 3 months. If you, which of this, when you say it, is a problem? You see, I'm focusing on CHF, on Digoxin, priority intervention. 3 things, that's all. If you say it, I'm worried. I make sure my apical pulse is greater than 60 before taking my medication. 60, 70, 90. 60 for adult, 70 for a child, and neonate for 90. If the apical pulse is less than those, we have a problem. We want it to be greater than. So this is for adults, this is for child, and it's for neonate. Therefore, this one, you're doing good. I have been drinking 2 to 3 liters of water a day. Digoxin, your creatinine is very important. Therefore, your kidney is key. It's cleared by the kidney. You want to make sure your kidney is okay, your creatinine is okay. Therefore, if you drink 2 liters of water, you make the creatinine happy and the kidney happy. We're doing good. I have been taking ondansetron for the past 4 days. Why are you taking ondansetron? This is used for nausea or GI upset. And for 4 days, you've been taking it. I told you, bad medications always look for first sign of GI symptoms. This patient is having Digoxin toxicity and is taking ondansetron for it. We got to evaluate. I've kept my lab appointment as scheduled. Yeah, you got to check your lab volume to make sure we have a therapeutic level of Digoxin. So she's doing fine with this. E, therefore, this patient, you should not be taking ondansetron. I don't like that. That's your right answer. Number 6, what do we have? A 60-year-old female client was diagnosed with what? Osteoporosis after a desert scan. You're supposed to say a scan here. Client was prescribed with alendronate. Do you recognize this medication? Which of the following states may need further intervention? I've given you a clue. Osteoporosis, that means they're losing calcium or their bone is being broken down. If I'll give you anything, I'll give you should prevent bone breakdown. So this medication is a bisphosphonate to prevent bone breakdown. It causes esophagitis. So there's things you need to tell the patient what to do. I will take the medication in the morning. Usually want you to take it in the morning, so no intervention. I will take the medication with 8 ounces of water because it causes esophagitis. That's good. I will remain upright for 5 minutes after taking the medication. That's good, but it's wrong because 5 minutes is too short. We need at least 30 minutes. 30 minutes. We want you to stand upright for 30 minutes, at least 30 minutes. So this is not great. I will not take the medication together with calcium. Calcium affects absorption of bisphosphonate. Even though this patient will be on calcium and bisphosphonate, you tell them not to take them together. So this one need further intervention. Number 7. A nurse is caring for a 37-year-old male client on flunitrazine. Which of the following need immediate intervention? Bring your content, look at it, look at the situation, short case, all you have is two words. 35-year-old fluoxetine need intervention. Then you ask yourself, what is this? First generation antipsychotic. What should you worry about? Whenever you hear antipsychotic, think about neuroleptic malignant syndrome, extrapyramidal side effect. You also have other symptoms. They cause antihistamine effect, anticholinergic effect. They have endocrine effect. They have a bunch of side effects. The dangerous one is this, followed by that. Extrapyramidal side effect, if you want to know, check adapted. NCLEX, if I call it adapt, the name of the channel. Acute dystonia, akithesia, parkinsonism, and tardive dyskinesia. You will learn how to take care of all of this. It's a board favorite. You got to master it. So, what do we have? Dry mouth. It's a side effect of fluoxetine, common side effect. Don't worry about it. It's not that dangerous. Is that more dangerous than gynecomastia, endocrine problem, growing breast? Or is that more dangerous than you having a fever? Or is that more dangerous than painful muscle contraction? Think about it. Bring your bridge up. And you have to bring your content. This is the disease, but you have to flip it into the bishop form. Okay. Dry mouth is unexpected finding. Gynecomastia is unexpected finding. Painful contraction is acute dystonia. Is acute dystonia. It's not NMS. NMS is they have fever, 103, 104, muscle rigidity, autonomic changes, basically hypertension, tachycardia. And so the most dangerous of all is not extrapyramidal side effect, which is painful muscle contraction, that fever, which is an indication of neuroleptic malignant syndrome. So 3 is the one that need immediate intervention. Number 8. The client was prescribed with gentamicin, keyword, for severe abdominal infection. Don't worry about that. It's irrelevant. The nurse provided appropriate teaching regarding the medication, provided some teaching. Which of the following statements from the client need further intervention? You see, it's a letter applying, further intervention. So there's 2 words. Gentamicin, further teaching is required. Bringing your content, like I told you, rewrite the question. We know the buzzword, gentamicin, further teaching, select and apply. What is the content you need to answer? You always have to spend 1 to 5 seconds to bring your content. Gentamicin, okay. The key fact is it causes toxicity, right? The hearing problem. And then the kidney does not like it. And then neuromuscular junction. That means it blocks neurons from talking to the muscle. It can slow things down. Like myasthenia gravis patients should not take gentamicin because they will have lack of transmission of messages between the neurons, and that can affect. So it can make muscle weak because there's no contraction. I will use acetaminophen for pain. Well, don't use NSAID because this affects the kidney. And if you use NSAID, your kidney is in trouble, and it's very toxic. It's a toxic medication. So whatever you want to do to stay away from any of these side effects, toxicity, which can be permanent, kidney problem, and neuromuscular junction is fine. Taking acetaminophen is a good thing. We don't need to teach you anything. I will limit my caffeine intake to 5 cups a day. You're going to get dehydrated. I don't want you to drink any caffeine at all, because if you're a little bit dehydrated, kidney get into trouble, gentamicin increases and become toxic. So thus, we need further intervention. I will notify the nurse immediately with hearing loss. Yeah, if you feel like ringing in your ear, call me as soon as possible. So this does not need intervention. I will drink 2 to 3 liters of water a day. Yes, so that your kidney will be happy. I will notify the nurse with any weakness because of a neuromuscular blockage. Yes. So Those are all signs you have to pay attention to for gentamicin. So the only one that need which of the following statement from the client need further teaching is B. Don't drink caffeine. Don't get yourself dehydrated. Question 9. Select or apply. Which of the following infection control plan need immediate intervention by the charge nurse? That means the charge nurse needs to intervene. The client presents to the emergency room with what? Flu-like symptoms. Rapid nasal swab antigen test was positive for what? Adenovirus infection. Which of the following infection control plan need immediate intervention by the charge nurse? Rewrite it. What is the question is asking? 4 lines. All you need to do is tell yourself, I have adenovirus infection. What control do I need? Drink your content. I need contact and droplet. That's all. Therefore, every answer choice need contact and droplet precaution strategy. If it's not, the charge nurse will intervene. Client in a negative pressure room. You don't need a negative pressure room. Therefore, the charge nurse is going to intervene. Nurse wear gown, good for the contact. Gloves, which is sterile. No, you don't need a sterile gloves. Surgical mask, good. But because of the sterile gloves is wrong, the charge nurse will intervene. Client wears surgical mask in the room. Client does not need to wear any surgical mask, no gown, nothing in the room. Charge nurse will intervene. The nurse wear the gown before entering the room. Yeah, if this is the patient in their room, the nurse wear the gown before you go for the contact. So this does not need it. Nurse employs single use. This is for the contact precaution equipment. So the only one the charge nurse need to intervene is A, B, C are the ones she need to intervene. Precaution. They are straightforward question. This is a calculation question. Okay, this is a calculation question. If you have those calculation problems, check out that point class. So what is the problem? Calculate the drop per minute. Okay, drop per minute and run the answer up. The nurse is caring for a client who need IV fluid resuscitation. The nurse received the following order. A liter of normal saline over 5 hours via a micro drip IV tubing. People get confused with this. Straightforward. I'm going to say some few things. Micro drip, it means the drip, the holes are small holes. Therefore, it's going to take a lot of drops per ml. So for every ml, you're going to have large drops, a lot of it. So this is usually 60 drops per ml. And this is what we use for kids. Even though this said micro is MI, is 60 drops. The macro, MA, we all know is bigger. The whole is bigger. Right? That means we're going to get less drops in ml. So you get 20 drops in ml. And this is used for adults. So for when they give you and it's a macro, you use 20 drops per ml. If they use micro, MICRO, you use 60 drops. If they don't give you at all, you use 15 drops per ml. If they don't tell you, most of the time they say 15 is average. So this is what you use. But this may pay attention that depending on what they tell you. The other thing too is I don't use formula, I just do dimensional analysis. This dimensional analysis came from this formula. It's from the prescribed dose, how much you prescribe, times what is available. It's your answer choice. So I will show you how you can apply it. So this is the key. What is the problem? The axis, calculate the drops per ml. So this is our answer. Our answer, all right, drops per minute. right? Drops per minute. So I need my answer to be in drop per minute. So what is my prescribed dose? It's dimensional. They say 1,000 ml of saline over 5 hours. So 1,000 ml over 5 hours. Right away, change this into minutes because the answer is in minutes. So you know 1 hour here is over 60 minutes. Therefore, the hour can say hour like that. Now, we're going to use our drops. They say what? Use what? Macro. Macro. The macro, even though this is, we know macro is big, it's actually the one that will give you smaller drops. So it's going to be 20 drops per ml. So 1 ml cancel. And therefore you left with 1,000 times 20 drops over 5 times 60 minutes. That's all. The answer, when you run it up, you're going to get 67 drops per minute, because this will go here and this will be 3, right? And this will be what? 200. So 200 over 3 is 6.6, 6.6, which is 67 drops per minute. And therefore the answer choice is this. If you have a problem, check it out in class. Subscribe to the channel, look down and click it. And if you have any question, email me. This is the way you answer and then be comfortable taking your NCLEX. Take care of yourself and good luck in your exams. Keep charging as always. All the best of luck. Bye-bye.